Hi, it's Dr. Launice, author, speaker, baby doctor who takes care of sick babies for a living. I like to help tired, stressed out, frustrated moms who have preemies in the NICU so that they can master their journey, better understand their baby's illness, and know what to expect for the future. So I'm going to wait a few seconds to see if other people will join the live, and then I'm going to get started. Okay, so once again, it's Dr. Launice. So I'm going to talk to you today about 5 things, that's right, 5 things that you need to know about late preterm infants. The first thing that I want you to know is, what is a late preterm infant? What does that mean? How do we define that? And a late preterm infant is any baby who was delivered from 34 weeks up until 37 weeks gestational age, and that's basically how many weeks baby's been inside mom in the uterus before delivery. And so we kind of describe them using this term. Now, if you were to Google it and look online, you may get a little bit of different variation in the weeks. And one of those reasons is based on sort of how we count how far along mom is, right? So in another video, I talked about the first day that the baby is born. We call that day of life 0. And then the next day, we tend to call that day of life 1. So the same way when we're following, mom and we're saying she's this many weeks, the first day that she hits 34 weeks, we call that 34 and 0. And then, the next day would be 34 and 1, 2, 3, 4, 5, 6. And then instead of saying, 34 and 7, we would say she's now 35 and 0. And the reason that this is helpful to us and that we use this information is because a baby who is 34 and 6 weeks, he's almost reached 35 weeks, is going to be very different sometimes in their maturity and their skill level at eating and doing those different types of things than a baby, let's say, who's 34 and 0, who kind of just passed the mark of being 33 weeks. So this is what I want you to know about. This is what we consider late preterm infants. So if you were to look it up, some people might say 33 and 6, or they might say 36 and 6. This is why there's a little bit of variation. Although you should also keep in mind, that sometimes dates and things are not exact. So a baby who's 37 weeks sometimes actually behaves a little bit more immature, and maybe that's because the dates are a little bit off and they're probably a little bit closer to 36 weeks. But first thing I want you to know is, what is a late preterm infant? It's a baby delivered between 34 and 37 weeks. Second thing I want you to know is, it's important to understand why we break the babies up into categories, and I kind of explain this, right? So a baby who is late preterm, has different issues than a full-term infant or than a baby who's less than 34 weeks, who would just be a preterm infant, right? So a full-term baby doesn't necessarily have to come to the NICU, right? We wouldn't expect it unless they had something else going on. There was an infectious process, or, something going on right before delivery or during labor where the baby's in distress or something like that. But a late preterm infant, we know they're more likely to have some common issues that preterm infants have, like, I'm going to talk a little bit later, but again, eating and temperature and those different types of things. So we would expect, that, as the NICU team, we're going to be at this delivery to watch and make sure that everything is okay with these babies, because we have in the back of our mind, right? They're almost a full term, but not quite. Again, this is going to be very different from a baby who's, say, 28 weeks or 27 weeks, right, who cannot breathe on their own and will need like extra lines and things like that to give them fluids and to, monitor their blood pressure and different things that we do. So this is why it's important for us to break it into categories so that you can understand, okay? It also affects how long our baby's going to be in the NICU. So it helps us to sort of break it up into these categories, because our expectations for a baby between 34 and 37 weeks are very, very different from like our micro preemies and things like that. The third thing that I want you to know is that not every single late preterm infant is going to be admitted to the NICU, which is exciting, right? So that means even if you're having a late preterm baby, doesn't mean that they have to be separated from you, that they have to go to the NICU. Now, there are some, different criteria that certain NICUs follow. For example, places that I've worked, any baby who is 34 weeks, and below automatically comes to the NICU. And the reason why, I've talked about feeding on one of my other videos, so check it out. But we know that at 34 weeks, babies are just sort of learning how to eat. They're just kind of learning that coordinated suck and swallow, so that they're able to go to the breast, or they're able to take a bottle and, take the milk or formula and swallow it and not have it go into their airway, and cause problems with their breathing, but to kind of go down into the stomach. So they have all these other things like maintaining their temperature. Again, we expect them to be smaller in weight and size. And so we know that, they're going to need closer monitoring for these things. Something else to keep in mind, since we've already talked about the different weights that babies have, we know that all babies, when they're born, will lose weight in the first week of life. Okay, so babies who are full term tend to regain back their birth weight. They regain that weight that they lost by a week. But babies, when they're late preterm, takes them a little bit longer, right? So for them, it could take them up to 7 to 10 days. And then when we're talking about babies less than 34 weeks, right, it could take them up to 2 weeks and sometimes even longer. So we already know if we have a baby who's being born at 34 weeks, we already know they're going to lose weight and they're going to have these other issues. So that's why these babies are sort of an automatic admission. But for babies who are 35, right, between 35 to 37 weeks, this may not necessarily be the case, right? Because they've had a whole extra week to kind of learn on some of these things and grow and mature and have their lungs develop and everything like that. So obviously the NICU team is still going to be there, right? Because we don't know exactly what's going to happen and we don't know what baby will look like, so we will still be there. But if baby is otherwise crying, it's not having any breathing problems, it's not floppy, looks good, and they don't call us and tell us that there's any other issues going on, then these babies will be able to stay, with mom and dad, and will be able to go in and out of the nursery and not automatically have to come to the NICU. So that's another point there that I just wanted you to know, that just because the baby is late preterm doesn't mean that they're going to get admitted. But again, we also have admitted lots of 36-weekers. So just because we've made it to 36 weeks doesn't mean that they can't still have some of these same problems. And again, even full-term infants who haven't been growing well and have low birth weights sometimes will need to come down as well. The fourth thing that I want you to know is, so what are all these problems that the late preterm babies can have? So I've kind of mentioned them, and I'm going to kind of talk about them more now. So one of them is the low blood sugar level, right? So when we think about low blood sugar, we tend to think of adults and diabetes and those types of things. But we know that babies, all babies can have issue with their glucose level, but especially babies who are late preterm, we know that they tend to be more likely to have lower blood sugar levels and are more likely to sometimes need extra fluids to keep their blood sugar level up to where it needs to be. Another reason, another common problem that they can also have is breathing difficulties, right? So like we talked about before, some babies will have trouble breathing. And again, as we know, even though they're getting older, they're not quite full term yet. So some of these babies may have, immature lungs, and so are more likely to have issues at delivery, or sometimes, all babies can swallow some amniotic fluid, but babies who are late preterms or preterm babies are more likely to be symptomatic, more likely to show signs that they're having trouble at delivery, kind of clearing that fluid, and are more likely to either need to have some type of breathing support, whether that's a cannula in the nose to give them some pressure and some flow of oxygen, or whether it's to put kind of a breathing tube into the airway to help them breathe. We know that they are more likely to have breathing problems. They're also more likely to have difficulty feeding. Again, if the baby is 34 weeks, they're just learning how to have a coordinated suck and swallow. So sometimes they need help with a feeding tube that has to go down through the nose or through the mouth, and they get their formula or the breast milk that way as they learn how to kind of eat more by mouth. And the more and more they eat by mouth, then we kind of get them off of the feeding tube, and then they'll be getting closer to go home at that time. But, again, they can have issues with feeding. And so this is another reason why we need to bring them in. And if they're having trouble with feeding, then they may not be able to get in enough breast milk or formula and not get enough calories that they need to, again, keep their blood sugar where it needs to be. So all of those go hand in hand. Another issue that they can have is maintaining their temperature, right? So babies who are late preterm, right, we talked about the weights, they can tend to be a little bit smaller. And so they just tend not to have as much fat, right, under their skin as babies who are full term, right? So they are unable to kind of maintain their temperature. They don't have enough of that brown fat that helps babies maintain their temperature. And so sometimes we'll see them right in that box in the NICU in the isolette that helps to keep them warm and helps to maintain their temperature. Because again, when babies are eating, they're sort of burning calories, they're expending energy. And so as they're working on learning how to eat, that also, causes them to spend more energy. And so then they have a harder time maintaining their weight. So all of them kind of go hand in hand. So what are the common problems that they have? One, they can have difficulty feeding. They can have difficulty breathing. They can have difficulty maintaining their temperature, and they can have issues with their blood sugar. Okay, so these are all reasons that late preterm infants a lot of times will end up being admitted to the NICU. And then finally, the last thing that I want you to know, okay, the fifth point out of all the 5 points is it's important to know, when might they go home? Okay, this is probably like the number one question I get from any parent, regardless of the age of the baby, when they come to the NICU, is when can their baby go home, which is a great question. But usually what I tell them is, the baby drives the ship. We are all just passengers, okay? So we can give you an idea, but ultimately each baby is their own person and they're all a little bit different, and they sometimes struggle with different things. So in general, I would say when we're talking about babies from 34 to 37 weeks, potentially they could be in the NICU from anywhere to 1 to 3 weeks, right? So for a baby who's at 34 weeks, who again is going to be the most immature baby in that category, I usually tell parents 2 to 3 weeks. Now, sometimes, again, because dates are off, you have a baby who's 34 weeks who just was like, I don't care about that feeding tube. I know how to eat, and they take everything down, and they're able to go home faster. But again, to master feeding, maintaining the blood sugar, maintaining their temperature, being able to come out into open crib, doing all of those things sometimes takes the babies up until 3 weeks. Okay, so if it's a baby who's now a little bit later, like 35 weeks, 36 weeks, sometimes they can get out in a few days up to a week. And sometimes, again, just depending on the baby, it can take longer. But I think if you plan on a week to 3 weeks, then you will have an idea of how to plan, what to know, and kind of what to expect depending on how many weeks your baby is. So once again, this is Dr. Launice. Please check out this video. Please share if you know anybody who has a preemie in the NICU or who has had a baby in the NICU. Please like my Facebook page. Please check out my other videos. Please follow me on Instagram and Twitter and YouTube at symbol Dr. Launice MD, DrLaunicE MD. Thanks for joining. Have a great holiday season and Merry Christmas. Thanks. Bye.